Hey guys, Dr. Jim Carmichael here to go over the deep venous thrombosis, or DVTs. Deep venous thrombosis are exactly what they sound like. They are thrombus, or clots, in the deep veins. They can be completely asymptomatic, or they can present with a dead patient with a little piece that's broken off and become a pulmonary embolism. Classically, the presentation is a swollen, red, and tender limb, normally tender along the deep venous tract, with a story suspicious for a DVT. Look for parts of the history consistent with the Virchow triad. First of all, stasis. Does the patient have a story about being still for a long time? Maybe they were on a trans-Pacific flight or had their leg broken in a cast for weeks on end. Number two, think about something that's like a hypercoagulable state. Does this person have a reason to clot when they shouldn't? Most people don't know this, but maybe they have a family history of people having clots for no reason. They may say something about factor V Leiden deficiency, and think about things we do to promote coagulation, like taking estrogen-containing birth control or smoking. Last, think about endothelial damage. This one goes with surgery a little bit, but think about trauma or other injuries to the intravascular space. You can use a D-dimer, which is a lab, to try to rule out a DVT. If the D-dimer is low, the chance is the DVT is probably not there. But if it's high, it does not confirm your diagnosis. The D-dimer is a very sensitive but not specific test. A venous ultrasound of the affected extremity is the test of choice. DVTs by themselves are not that dangerous, but they can break and become those super deadly pulmonary emboli, and that's why these have to be treated. So how can we treat these? Well, generally people will use some form of heparin, either fractionated or a low molecular weight heparin, for immediate management, while you start them on Coumadin and allow the patient to reach their therapeutic INR in a few days. With the new oral anticoagulants, the factor Xa drugs like apixaban, rivaroxaban, you can start these patients on the medication and they are immediately anticoagulated. You don't have to do the heparin bridge. That's it for this one, guys. We'll see you at the next lecture.